The surgical assistant, as you can imagine, plays a very important role as part of the team. And one thing I do want to point out, if you have an interest and possibly want to pursue working in an oral surgery office, becoming an oral surgery assistant, I would also say not to rule out periodontics. As you learned with the specialty perio, it deals a lot with the gum tissue and the bone, and surgery is going to be a huge component to that, as well as being able to place implants, which is done also in a periodontal office as well. But as a surgical assistant, uh, you're going to be involved in very invasive and in-depth procedures. So as the assistant, it's important to be very knowledgeable and very, advanced in some of your skills, because you're going to be dealing, with patients in a much different manner than if you were working in a general office. So being knowledgeable is very important. As the surgical assistant, your role is to assess the patients and also monitor them while they're on and under general anesthesia. You're going to be using specialized instruments and being knowledgeable in what those instruments are and the order of their use depending on the procedure that you're doing. You're going to be heavily involved in surgical asepsis and infection control, because in surgery you're opening people up, so making sure that your environment that you're working in is going to be sterile, and how to make sure that you prepare and also break down your rooms is going to be very important. You're going to be involved in assisting in a lot of different variety of surgical procedures that are going to be taking place. And a huge part of your role is pain control and what techniques you're using to help your patients. You may not be directly involved in pain control when it comes to IV sedation and inserting the IV, but definitely monitoring them and ensuring that their vitals are where they need to be is going to be very, very important. There's actually a certification that if you do work as an oral surgery assistant that you might look into possibly taking if it's not recommended or required by your oral surgeon. And it's called the DANCE certification. It stands for Dental Anesthesia Assistant National Certification Exam. And it's, what it does is it allows you to be a certified anesthesia assistant, which is very important because you're going to be working in an environment where a lot of times your patients are going to be under local anesthesia or general anesthesia, IV sedation, could be, some anti-anxiety medications as well, and being knowledgeable and how to monitor your patients is going to be very, very important. But as a dental anesthesia assistant, once you get that certification, you're definitely going to possess the expertise in order to provide supportive anesthesia care, which is going to be in a very safe and effective manner. You're going to be very knowledgeable in perioperative and also emergent care management of patients who are undergoing office-based outpatient anesthesia, and also just being able to be effective in how you're communicating very pertinent information not only to the patients but also to their caregivers or the person who is bringing them to and from their appointment, as well as other members of the healthcare team, whether it's your own team or possibly communicating information to that patient's general dentist as far as what procedure was done and what medications were given. So definitely something to look into. I did want to show this video that kind of lets you kind of get in the minds of a couple of surgical assistants to kind of get a feel for a little bit of what they do.
My name is Kim Lige, and I'm a surgical assistant. I work with Dr. Parker, and he is one of the easiest doctors I've ever worked for. I mean, we have a relaxed but professional atmosphere to work in, and it just makes doing your job a little easier. The patients here love our doctors. I mean, they have great bedside manners. They interact with the patients very well. As a surgical assistant, my main concern is to make sure that the patient is relaxed, comfortable, and well taken care of. The staff is great. I mean, each doctor here has, their own personal team, but the whole group is just, amazing to work for.
My name is Courtney Mathis, and I'm a surgical assistant for Dr. Ingalls. Working with the doctors are great. When I first started here, I was first considered a floater, so I got to work with each doctor. Then Dr. Ingalls decided that he wanted to hire me on his team, so I got to strictly work with him and the group that he has, and I've thoroughly enjoyed it. Well, we first bring the patients back. We ask them if anything's changed in their medical history. We'll get them hooked up to all the monitors, put them a blanket on, make sure they're comfortable in the chair. Some of our patients that come in nervous, we'll hold their hand while we start the IV. Just make sure they're comfortable until they drift off to sleep.